20 years ago, common sense told me that the health of a woman, even before conceiving, let alone during pregnancy, could lead to better outcomes for the child. Now, more recently, the American Heart Association made a scientific statement really validating a lot of this. So let's talk about it. Hey everybody, it's Dr. David. So, as you know, in functional medicine, this is something that I've been working on really all millennium because I first started looking into it in around 1997, 1998, working specifically with children with autism. And we would focus on all types of things like their gut health and their nutrition and detoxification. And parents started saying to me after their kids were significantly doing better, hey, we want to have another child. We're afraid to do so, but maybe some of these issues that we have with our children with autism, maybe those same biomedical, those same chemical issues are present in us as the parents. And wouldn't it make sense for us to be checked as well? Which, of course, how could you, A, say no to that? But of course, how could you deny that, especially if you found problems in the children? And recognizing that most parents are not much different than older children, right? I mean, as in like young adults and teenagers. Like, yeah, sure, I can do that. Now, as I've talked about before in function medicine, and the grandparents and more started asking me, of which I was more hesitant to take on those patients because I'm a pediatrician, not a adult medicine doctor. But I felt we could apply the same principles to functional medicine, no matter who you are, and still make a difference. I just had to learn how to dose for adults. Now, it's been relatively recent, historically speaking, that we know how important certain things are during pregnancy for pregnant women. Alcohol consumption. It was a thing. Now we know the answer is zero. Smoking. When was the last time that you saw a pregnant woman smoking? Right? We know about that. There's really nothing good that comes out of burning anything into your lungs, let alone nicotine, of course. That good will come out of that. Okay. Pesticides. Research is now showing the importance of organic food. People who live in near spray fields are more commonly going to have children with autism. Overall, just nutritional intake, making sure the proper proteins, fats, carbohydrates, calcium, vitamin D, all of those things are there. And those things are certainly now very mainstream. Right? Nobody, I think, would argue about any of those things whatsoever. And of course, in our functional medicine world, we go a lot further than that. But still, now it's not a radical idea. And it wasn't radical during pregnancy, but a lot of people, when I first came up with this, it was the first, not that they thought it was a bad idea and talking with colleagues. It's just I couldn't believe how many people told me and physicians, wow, or nutritionists, why didn't we think of that before? Get them before they are pregnant. And I'm like, yeah, it kind of makes sense, right? And so it's not a controversial thing. It's just it seems as if nobody had really thought about it before about 20, 25 years ago. And so that's kind of how I went into and created my Preconception to Infancy project. And then, as you may know, and I've talked about it here before, that in 2012, I published an article in Autism Science Digest that went through the different functional medicine approaches and things that I look at thyroid and nutrition. That's some things I've talked about before for a woman to be checking. And of course, the dad too, we want his one sperm cell to be as healthy as possible as well. But of course, the incubation inside the mommy is where it's even more important. Okay. So of course, as the children recovered, I started looking more into this. And so we started applying the same principles. Now, we saw a really amazing thing. You may have heard that about 1 in 8, maybe 1 in 10 children, if you have one child with autism already, of having a second child. And if you have two already, then the chance of number 3, even more so than that. Okay. We've seen less than a handful in the 20 years or so since I've been doing this. And lots of things that I do differently. So I can't tell if there was any one particular treatment or test that we did in order to do that. But I kind of, from a functional medicine perspective, it's kind of like putting a puzzle together. You want to have as many pieces on the puzzle on the table as possible to make the best thing. You want to fill as many holes in the dike, if you will, before in order to make the most optimal situation. Okay. Now, after I had published this, I was actually invited by to do a think tank up in Portland, Oregon. Myself, along with Dr. Martha Herbert, who was one of the heads of autism at Harvard at the time, and Dr. Skip Kingston, who was at Duquesne University, and he literally wrote the book on on mass spectrometry and measuring tiny amounts of toxins in the environment as well as in people. So the three of us were tasked. I did the clinical part. Dr. Herbert did a lot of the research part. Dr. Kingston talked about toxicities, and we had a 2-day think tank. And this paper that I had written, turns out that it kind of went global. I was told that it was in multiple, like the health departments of state health departments of health were asking for help on it. They actually set up clinics following this with our permission in China. A lot of OBGYNs. It seems to be picking up more in Europe than it is over here. So I've been continuing trying to bang the gong on this of how important this is for everybody. And of course, this should be standard of care for everyone. Okay. Now, in addition to those things, I always talk about proper exercise, proper sleep, and making sure the proper B vitamins are there. I've talked about MTHFR and methylation genetics. You go back to the interview that I did a couple years ago with Dr. Ben Lynch, who is one of the national gurus on this. And we had a fantastic long conversation there as well, if you want to go back and see that. But we do certainly know, and this is where it comes around more to the American Heart Association part, we know that there are certain conditions during pregnancy that are cardiovascular related, such as what? Okay, gestational diabetes. Okay, what happens if obviously if a mom's blood sugar is off, and that can cause all kind of problems for her. But also, a baby who is born to a mother with uncontrolled gestational diabetes, more than likely, they are big babies. It's called macrosomia. They grow too big, which besides can be very difficult to pass through the birth canal if you have a 10 or 11 pound baby. But also, what's happening is when the mom's sugar is high, the baby's pancreas is having to make more insulin to deal with what's coming through the umbilical cord. When the umbilical cord gets cut, all of a sudden that sugar cuts off to the baby. But the baby still has high insulin compared to what it was before. High insulin, no sugar coming in, and they would go through blood sugar crashes that can cause seizures and all kinds of health issues, ending up babies in the neonatal ICU. So clearly, that could be a problem. And the macrosomia of the baby cannot just be a big body, big organs that can have problems as well. So this is a real potential issue. Another one that people frequently know of, preeclampsia, high blood pressure in the mom. Okay. And sometimes this can be handled by bed rest, and sometimes they need to do medications and magnesium and such. But what's the problem here? Well, high enough blood pressure can restrict blood flow through the placenta and can cut off nutrition and oxygen, etc., to the baby. This can lead to premature births. Babies under distress, their body recognizes get out. But it also can lead to what we call small for gestational age. So a small baby, microsomia in this case. And I've seen babies who were full term or close to it, but because there was uncontrolled high blood pressure, it could be like a 4 or 5 pound baby. And that's a problem, obviously, for many reasons as well. Okay, so now going on to that, this is what the from the American Heart Association, one of the the vice chairman of the writing committee. So it's not a study. This was a formal document, a statement put forth by the American Heart Association. I've put the link in the show notes in the description below. Okay, but Dr. Holly Gooding, that's her name, and so I can quote it properly, which you're going to at the end of this quote say, "Duh." But she went on and said, if you optimize the pre-pregnancy health of the mother, that optimizes her health during pregnancy, which affects the health of the child later in life. Right? Duh. Who would say no about that? But, I'm glad that the American Heart Association came out with such a strong statement. Kind of sad that they had to, because not everybody realizes it already. But hey, we're learning. We're moving the ball forward. We're moving them more in our direction all the time, and that's obviously a good thing. Okay? Now, a couple of things more about this. Cardiovascular issues with a pregnant mother, accounts for about 1 in 4 pregnancy-related deaths. Okay, which we know is a big problem. And we've also heard, and we also know, I should say, that since pregnancies can sometimes happen unexpected, even in teenagers, the part of the recommendation, as stated by this, is that all the American Heart Association says all women ages 15 to 44, so all childbearing age, doesn't mean they're trying to get pregnant, but things go bump in the night, things happen. We know about that. So they say all women like that should be working on this before they even have a chance to get pregnant. Again, hooray. And of course, in my adolescent pediatric functional medicine practice, we don't really get many any adolescent pregnancies, but we're still focusing on these same concepts because you are a human, and we believe all humans should be doing this. Okay, so now as part of this and part of the challenge is we know that there are significant disparities in cardiovascular health, not just during pregnancy but overall, based upon race, based upon ethnicity, based upon social economic status, and also geography where people live. Okay, one of the things which is one of the saddest is that Black women face triple the risk of dying from pregnancy related conditions than white women. 3 times. So underserved populations, not getting the same level of care when they get to the hospital, potentially more being blown off. We know that this is part of the systemic issue in terms of how different races are treated in our country. It's sad, but it exists. Okay. Now, the American Heart Association has what they call the Life Essential 8, and these are principles that everybody should follow, including women of childbearing age. And again, all of these things are going to be does, and all of these things pretty much I've talked about before. But again, it's nice to know that the American Heart Association, certainly very respected and by physicians and everybody in our country, is making these types of statements and putting them out. So hurrah, hats off to them for doing this, right? This is helping people. Okay. So these are what the life essentials are. Eat better. Okay, right. High fiber foods, minimally processed foods, avoiding added sugars, avoiding artificial sweeteners. Very helpful. Okay, being more active. We all should be doing about 60 minutes of exercise most days of the week. And with part of that, getting our heart rate elevated. So just going for a walk is nice, but the kind of way of looking at it from elevated heart rate is if you cannot sing or talk in a regular manner because you have to take a breath before you can talk again. That is the level of exertion that one should be doing in order to kind of hit that really helpful from a cardiovascular perspective. Okay. Next one, quit tobacco. Again, nothing ever good comes from tobacco. Okay. Manage body weight, keeping the body mass index under 25. Now, I've talked already about how body mass index is not the complete golden standard. There's other aspects to it as well. But especially in this time period, it's a good enough measure that if a person has, a body mass index of 35, they're obese. They're obese. And that's not helpful on many different levels. Now, also controlling cholesterol. How do we do that? Besides these lifestyle things, plant-based foods, minimizing the intake of animal products. Obviously, vegans, the end extreme, if you will, but even plant-based diets where maybe a person will eat 3 animal protein containing meals per week. Obviously, there could be differences because fish is a little different because of heart health, etc. But especially avoiding mammals, which is what I choose to do. Red meat, that's kind of be the bigger, but also keeping poultry to not be overdoing it either. Okay, managing blood sugar, right? Again, avoiding added sugars. Really important. Consuming proteins whenever carbs are consumed, because proteins stop the sugar jumping down and therefore the insulin jumping down that happens. So it keeps kind of things a little more natural. But there's a test that we can do called a hemoglobin A1C. And this is actually the best screening test for diabetes because it puts a nick in the hemoglobin when the sugar's too high. And that doesn't fix it. It's damaged permanently until the red cell dies off. And it takes 90 to 100 days for a cell to die and to recirculate the blood. So that's a really good test because you can't just fool somebody by doing a finger test, and you ate well that last week before for a finger prick. But it's actually measuring your average over the past at least 3 months. So you can't really fool this test. Okay. Managing blood pressure, kind of as we talked about, again, weight loss, exercise. You want the top number, the systolic, to be under 120. You want it to be the lower number to be under 80. Okay. Obviously, it get 125, 82s, but you really don't want to see it above 130. You really don't want to see that bottom number above 180 above 80 and for sure 90. But of course, there's other things we can do. Meditation, yoga, seeing a therapist, ways to reduce our stress because stress makes our blood pressure go up, as well as can interfere with sleep. And that's a whole other problem too. All right. So what does this really mean? If you want healthier babies, we need healthier mommies. Have a nice day.